In this video, we are going to talk about calcium, bone health, and osteoporosis. 99% of the body's calcium is stored in bones and teeth. And one of the functions of calcium is to provide structure to bones and also in teeth. Now, bones are also a bank that can release calcium if there's a drop in the blood concentration of calcium. The remaining 1% of calcium is found in body fluids, and it has many functions. It helps to maintain blood pressure. It's used in blood clotting. It's essential for muscle contraction. It's used in nerve transmission, and it activates cellular enzymes. So with calcium being so important, where do we find calcium in the diet? Well, dairy products such as milk, yogurt, and cheese are some of the best sources of calcium. And by the way, cottage cheese isn't really that high in calcium. You can also find calcium in fortified beverages like soy milk or almond or rice milk or orange juice. And you need to check the label because it needs to be fortified to have calcium. Now, tofu, which is a soy product, actually has calcium in it. And that is because as they make the curd of the tofu, they use calcium sulfate to do that. So that has calcium in it. Other sources of calcium are spinach, kale, and broccoli. The calcium is poorly absorbed, and we'll talk about that a little more in a bit. And almonds are a good source of calcium. Now, on average, about 25 to 30% of calcium is absorbed from food, but the body's pretty incredible. It can increase absorption if needed. So, for example, pregnant women can actually double their absorption of calcium, and breastfed infants can absorb around 60% of the calcium from breast milk. But like we said, calcium's not 100% absorbed from food, and the DRI takes this into consideration. So let's take a look at some of the variations in calcium absorption of different foods. So we've got this table here, and in the first column, we just have a list of foods and a typical serving size, like a half a cup for vegetables, a half cup for beans, a cup for juice, soy, or milk, and 1 ounce of cheese. The second column shows the amount of calcium in that serving, in that typical serving that we have. The third column shows the percent of the calcium that is absorbed from that food. And the fourth column shows how much of that food you would need to eat to get the same calcium equivalent as consuming 1 cup of milk. So we're just using 1 cup of milk as the standard here. So let's take a look at what this actually means. So if we look down here, we can see that if you eat spinach, it has a half cup has about 115 milligrams of calcium, but only 5% of it is absorbed. And you would need to get equivalent to 1 cup of milk, you would need about 8 cups of spinach. That's a lot of spinach. And this happens because in some foods, there are compounds that basically bind to the calcium that reduces the bioavailability. Now, remember that the DRI already takes into account these different absorption rates. So you don't need to do anything with absorption. You can just look on the label, and whatever the amount of calcium is, you can add that up for your calcium amount. Now, one of calcium's main functions that we talked about is bone structure. And calcium combines with other minerals to form hard crystals that give bones structure and strength. Osteoporosis is a bone disease that can lead to bone fractures. And what you're looking at in these two pictures is you see a picture of a bone on the left that has good structure, and you can see that's strong, and it's going to make a strong, healthy bone. But on the right, that is what osteoporotic bone looks like, and you can see that there's not good structure there, that the bones could break more easily or bend more easily. So people with osteoporosis, one of the things that happens is they can develop curvature of the spine that actually makes them short in height over years. And this actually can cause some pain, especially in the back and the vertebrae. And in severe cases, this curvature of the spine can decrease the volume of the chest cavity, causing difficult breathing or pain in the abdomen, and that can even lead to decreased appetite. Well, key to preventing osteoporosis is to gain peak bone mass when you are young. So let's look at this graph here. So throughout life, from about birth to age 20, your bones are actively growing. Now, between ages of about 12 to 30, that's when our bones achieve their maximal bone density for life, or their peak bone mass. So usually by about age 30, most people have their peak bone mass. Then around 40 and later, bones actually start to lose calcium and lose bone density. And beyond those years, the bone resorption exceeds new bone formation, and so we lose density. So this means it's really important to build your bone density when you're young, usually before age 30. Let's look at some of the risk factors for osteoporosis. One is being females. Females have a 1 in 4 chance of developing osteoporosis, where males have a 1 in 8 chance. Race can affect risk. Being Caucasian or Asian increases the risk for developing osteoporosis. Just getting older, the older you get, the higher your risk, and that's related to bone density. Having a slender build or a small frame increases your risk for developing osteoporosis. Having estrogen deficiency, either from going through menopause or a surgical removal of ovaries, can increase risk for osteoporosis, or having amenorrhea from eating disorders can lead to an increased risk for osteoporosis. And testosterone deficiency in men can also increase risk. People who smoke have an increased risk for osteoporosis, especially women, because smoking can lower estrogen. Being physically inactive increases your risk for osteoporosis. From a nutrient standpoint, having a diet that's low in calcium and vitamin D increases risk. And also, if you have excessive protein intake, excessive sodium intake, and excessive caffeine and alcohol intake combined with that low calcium intake, so any of those, that also increases risk of osteoporosis. And of note, there have been some studies that show that excessive soft drink consumption may be related to risk of osteoporosis. So how do you prevent osteoporosis? Well, as mentioned before, you want to build your peak bone mass. So how do you do that? First thing is your diet. You want to consume a diet that's adequate in calcium, vitamin D, and protein. Next, you want to be physically active. And you want to particularly do what we call weight-bearing activities. These are activities that put weight on a long bone. A long bone is like the bone in your leg. Think of it's long. So walking would be a weight-bearing activity. Jump rope would be a weight-bearing activity, as opposed to swimming, which doesn't put weight on those long bones. So don't confuse weight-bearing activity with lifting weights. It's different. It's where we're putting weight on the long bones. And then lastly, you want to start early. You want to start young and get that peak bone mass while you're in your youth. What if it's too late? And how do we treat osteoporosis? Well, first we use diet, and it's basically the same diet as we use in preventing osteoporosis. So you get a diet that's adequate in calcium, adequate in vitamin D, you have enough protein as well. You can use fortified foods if you need to with calcium, like fortified orange juice or a cereal that's fortified with vitamin D to get enough of those nutrients. Now, some people may need to take a supplement of calcium or vitamin D, like a pill or a chew. So you take them to supplement the diet, not to replace things in the diet. And there's some things that will help when you're taking supplements. One is take the supplement, calcium or vitamin D, with food. That helps with absorption. The next thing is if you take iron, don't take your calcium and iron supplement together because they can compete. So iron can decrease calcium absorption. So take them at separate times during the day. Now, many people with osteoporosis will actually need prescription medications, and there are various therapies that help to reverse bone loss. There are medications that inhibit the activities of bone dismantling cells. There are some medications that actually stimulate the bones to build cells. In some cases, they might look at estrogen for non-menstruating women to combat that low estrogen level. And then lastly, you need to be physically active. Now, for those who are taking supplements, we do want to talk about excessive calcium intake. So calcium is a way that we help in part of the treatment process, but you can get excessive calcium intake, and it generally only happens with supplements, not with food. So what are some concerns? One is you can have GI issues, and the biggest one is usually people will develop constipation, but you can also get some gas and bloating with excess calcium supplements. Another one, and we mentioned this before, is calcium can inhibit absorption of iron and vice versa. But calcium can also inhibit the absorption of magnesium, phosphorus, and zinc, so it affects other minerals in large amounts. Calcium can also interfere with the absorption of certain antibiotics. So if you need to take an antibiotic for an infection, calcium may impact that. Now, we rarely see excess calcium in the blood. We usually only see this when we get calcium supplementations that are 4 times the upper limit, so really, really high. So this is a very, very rare complication, but it can happen.